Before we begin, I'd like to introduce Premier of Nova Scotia, Stephen McNeil, and our Chief Medical Officer of Health for Nova Scotia, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Before I turn it over to Dr. Strang to give us an update on COVID-19, we do want to acknowledge that we in Nova Scotia have had our second death associated with this terrible virus. And I want to say on behalf of all Nova Scotians to the family, there are no words and really no ability for us to understand what you're feeling today, but I want you to know that we as a province are here for you. We will be thinking about you over this Easter weekend. As you grapple with your loss, we will be there with you, trying to somehow understand it, but also to support you. So we are wrapping our arms around you. Dr. Strang.
Thank you, Premier. So today we are announcing 31 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 373. There are currently 10 individuals in hospital. 4 of those are in intensive care. 82 people, good news, 82 people have now been recovered and considered that their COVID-19 infection is resolved. We've tested 12,346 Nova Scotians and that number have been negative. So to me, that's an indication we are testing a lot of people. The vast majority are negative, and that's really good news. As the Premier said, sadly, I have to confirm that Nova Scotia, we are reporting our second death due to COVID-19. The deceased is a woman in her 90s with underlying health conditions who passed away in hospital in Cape Breton. I also want to pass my sincere sympathies and condolences along to the family. The loss of a loved one is difficult at any time, but losing a family member at a time when we are being asked to stay separated must be especially challenging, so my deep sympathies. I cannot stress enough the importance of following the public health measures we have put in place. We're all at risk from this disease. Some more vulnerable than others, but the impact of the virus and the impact of what we are putting in place to control the virus is and will touch all of us. So if you're not worried about yourself, please think about those in your community, those who are most important to you, and what you can do to help them and protect them. We are heading into a long weekend, but it's going to be a very different long weekend than we are used to. People on the front lines of this pandemic in our healthcare system and in our grocery stores and other places are not going to take a break. The virus is not going to take a break either. So please remain vigilant, follow the public health measures, stay at home as much as possible, and monitor your health. If you are experiencing symptoms that could be COVID-19, and those are the things we're looking at, people with 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose. If you think you have those symptoms, please go, if possible, go to the 811 website and do an assessment there, and they'll direct you further about whether you need to then call 811 and go for testing. If you don't have internet access, then you can go directly and call 811. Don't wait till Monday or Tuesday thinking that the healthcare system may not be there for you. We have 811 is a 24/7 service. Our assessment centers are operating throughout the weekend. The healthcare system will be there for you if necessary, whether it's COVID or some other health concern. But if you think you might have COVID, don't wait until Tuesday or Wednesday, till the Easter weekend is over. Do the assessment as soon as you can. I'd like to clarify some of the processes that we have in place now for workers coming into Nova Scotia. My public health order states that only healthy workers in certain professions and industries are exempt from self-isolation when they cross our borders. This is necessary to keep goods and services moving throughout our province and to allow people who cross our land border just north of Amherst on an ongoing regular basis to go to work, that we need to allow those people to move. Today, we are announcing that we have made a change that does impact fishers and offshore workers and temporary foreign workers. Any offshore worker or fisher entering our province must self-isolate for 14 days. Fishers can self-isolate on their vessel, provided they're able to do so for 14 consecutive days. We recognize that they may need to dock to get supplies, but they can do that without leaving their vessel and have the supplies delivered to them, and then go fish for that 14-day period. There's also been questions about temporary foreign workers. We know that there are several industries in our province, important industries, that rely on these temporary foreign workers. A key one is our agricultural sector. Temporary foreign workers will be allowed to enter the province, but they too must self-isolate for 14 days when they arrive. That is a requirement under the Federal Quarantine Act, and is also now a requirement under my provincial public health order. The provincial government is working with the agriculture sector and other industries as necessary to develop the appropriate capacities to ensure adherence to this 14-day self-quarantine period. I know that this virus is causing people to feel afraid. I understand that. For almost all of us, we've never been through anything like this before. It's natural to be afraid. That's okay. We need to talk about that fear and allow that fear to be out in the open and be validated. We also have to remember that there are things we can do that give us some control over this, the things that we can do to protect ourselves and protect each other. And that by focusing on, recognizing that fear is okay, but by focusing on what we can do to help each other and protect ourselves and each other, that gives us some sense of control. And by doing that, we know that we can get through this, and we'll get through this together. I continue to hear some stories about unfortunate the way people are being viewed and perhaps treated in our communities. We have truckers that are being denied service, healthcare workers who are being shunned or treated differently because people are afraid that they may carry this virus. We have still some targeting of people from specific groups within our community, somehow under the belief that they are the cause of this virus, or they're much more likely to be spreading this virus in our community. It's important that we understand that this virus affects all of us, that we all are at risk. But the way we deal with that is by being kind to each other, by supporting each other. So I really plead to people that let's not be judgmental of each other. As I've said before, this is an opportunity for us to look at each other with caring and compassion. We're about to enter our Easter weekend. We are in the middle of Passover, and soon it will be Ramadan. These are important religious celebrations to many in our community. And like so many other things right now, these religious ceremonies will need to be very different. No in-person services, gatherings, or meals. But they do remain an opportunity for strong emotional connection and building community virtually. In my faith, Easter is a time of hope in the darkest of events. The same is true of Passover. Ramadan has a strong focus on reflection and service to community. I would encourage all Nova Scotians, regardless of their faith or point of spiritual connection, to see that as challenging as the pandemic is for you, your family, and your community, there is hope, and we will recover. If we focus on caring, kindness, selflessness, and building up community, we will get through this, and maybe we will be better. We'll be different, but maybe we can be better. I care deeply for this province, and I care for each of you. I hope everybody has a safe weekend staying at home.
Thank you, Dr. Strang. I want to actually attach myself to your words of out of darkness there is hope, and as we enter into Easter weekend, while there is darkness for us as a province, there is always much hope for us too. I also want to remind all of you that a few other reminders. I want to remind everyone the applications for the Small Business Impact Grant and Worker Emergency Fund will be opened at 8 a.m. tomorrow. There's a 1-800 number that will be staffed daily from 8 a.m. to 8 p.m. starting tomorrow. And all the information you need is available at the Nova Scotia Coronavirus website. I want to remind people that as this long weekend approaches, if you are entering Nova Scotia, we are going to get a little stricter. Unless you're arriving to provide essential service, you'll be asked why you are coming. So please don't come to shop or visit a friend. Now I want to offer a few other reminders. We've delayed camping season and closed our provincial parks. This includes private campgrounds. I want to also remind everyone that if you drive to go for a walk, you've gone too far. You can still walk in your neighborhood. Your kids can play in your yard, but they can't play with their friends and they can't hang out in groups. Home is where the heart is and where the kids should be this weekend. But home is not always safe for everyone. I want to ensure the women and their children who are seeking safety to shelter are open 24/7 and they're there for you. Kids Help Phone and the Nova Scotia Mental Health Crisis Line are also available at all times. We recognize some Nova Scotians may need additional support, and that's why on Saturday at 9 a.m. we are launching an enhanced 211 service. This will connect people who need assistance to the Red Cross, where they can receive wellness check-ins, particularly those who are isolated and feeling lonely or afraid. Now we'll be happy to answer any questions that you may have.
I just want to remind folks that we had a bit of a technical issue, so if you're having trouble getting through the line, we apologize and keep trying to get through. Each reporter will receive one question and one follow-up. We'll start with CBC's Jean Laroche. Are you there? Okay, we'll come back to you.
On mute. My bad.
Okay.
Sorry. Hi, Chrissy. Dr. Strang, the federal government's latest projections has the first wave of this virus under control, if you can call it that, by sometime this summer. You've been saying in Nova Scotia we're 2 to 3 weeks behind most other provinces. What does that mean in terms of the begin to return to normal in this province, and what specifically does the return to normal look like in terms of things like going to the beach, attending concerts, or even travel?
So thanks, Jean. I think, I'm aware of that modeling study released today. I haven't had a chance to delve into it in any detail. I think it's consistent with what I've been saying all along, that this is a 6 to 8, likely a 10-week period of this first wave, and then there'll be a slow decrease over that. So it's likely we're into June before we can think about starting to lift some of the measures that we have had to put in place. What that exactly looks like, I don't know for sure, Jean, but it's allowing people to be a bit more active in their communities, opening up some of the things we've closed. But and people need to understand that has to be done slowly. It's not just all of a sudden we can flip the switch back on. We have to watch the progression of the disease in our province with good epidemiology and understand when we might be able to start loosening things off. As I'm saying, that June is simply a projection based on how we anticipate the virus to go. We'll, as things go on, we continue to monitor it. We'll be able to be a bit more specific on what that is actually looking like. But again, how we release all these restrictions is going to be a slow, steady, careful process. So I think people should expect that even the summer is going to look somewhat different than most summers. We also have to understand that more and more the experience and the modeling and the infectious disease experts globally are saying, because there is no underlying immunity to this virus, we'll still have a lot of people after the first wave who don't have immunity, that we can fully expect a second wave perhaps in the fall and maybe even a third wave in 2021 that may not be as severe as the first wave because we have some immunity. But I think the overall message is that there is no short-term solution here, that this is likely to be something that waxes and wanes over the next 12 to 18 months, and also therefore our restrictions are going to be tightened and loosened perhaps several times over the coming months. I know that's perhaps difficult to hear that, but that is the reality if we continue to focus on what's necessary to keep people alive, prevent avoidable deaths.
Jean, do you have a follow-up?
I do. This is for the Premier. Mr. McNeil, the Alberta legislature is sitting, albeit as a reduced quorum. Legislature committees are meeting virtually in BC, and 3 weeks ago, As you know, the New Brunswick government struck a deal, a special COVID-19 committee made up of ministers, premier, and opposition party leaders. As your government continues to make funding and program announcements, what plans are there to ensure MLAs from both sides of the House here are able to provide input to your decisions and to hold your government to account for those decisions?
Well, there is usually a morning call between all three offices about either things that have happened the previous day or an opportunity for them to bring input into government, things they're hearing from their constituents. As you know, we've already passed a budget. Many of the funding announcements that were coming through is obviously changing as we move, but we're making those investments inside those envelopes. Government will continue to be held accountable by Nova Scotians, and by those not only who sit across from us, but those in communities from one end to the other who are dealing with this issue of COVID-19. And I want to thank them for their tremendous collaboration and support. I've heard from businesses and community leaders from one end of Nova Scotia to the other who provided good suggestions, understanding the difficulty that we're in uncharted waters, unprecedented times. And I want to thank them for being constructive. You won't be surprised after covering the legislature for as long as you have. The environment around the legislature isn't always constructive. COVID-19 has provided an opportunity for that. We've provided a window into the decision with government through the morning meetings that are happening between staffs of all caucuses. And the way municipal leaders and their partners have reached out has been positive. We, at this time, do not see that the legislature will be sitting anytime soon. It doesn't have to sit again until the fall. We need 2 legislative times a year, and but if it's required, we'll be reaching out to the other parties to have a sitting.
Next, we'll go to Global's Jesse Thomas.
Hi there. Appreciate it. I guess we talked a little bit about some projections there, and I think a lot of people are anxious to make plans for the future and find out when life might be getting back a little bit of normal. You kind of hinted at it there, Dr. Strang, but we saw Canada release its numbers today, and then New Brunswick just released its projections, and I think most of the provinces have. And we were told we'd get the projections this week. Over the past 3 days, we've been asking for a date. So I'm just wondering, when can we get a date to hear these projected numbers for Nova Scotia? I think a lot of people want to know some more information.
So I understand the desire for that. We continue to look at that. We want to make sure that the modeling that we've done is actually as valid as possible. All models have degrees of uncertainty in them. We want to make sure that Nova Scotians that are given information that's helpful to them, and that's something that what we put out is something we can stand behind. So we are working on that. We're also working certainly within our healthcare system to make sure that they have good information and how they base their planning assumptions and anticipate what they need in terms of services. So that work is ongoing, and it will be coming in the near future when we feel comfortable that we're able to bring that forward and have confidence of standing behind what we will bring forward.
Jesse, do you have a follow-up?
I do. I guess I just want to talk a little bit about face masks. We've heard from the nurses union about complaints that nurses don't get to change their mask during a shift unless something happens to it, I guess. Is in the NSHA healthy supply contingent, there's 1 mask per shift policy. Is that what we're basing not having a shortage on in terms of these masks?
So we're looking at, the work that's been done on starting with healthcare workers in hospital who provide frontline care. And again, I remind folks, this isn't about protecting the healthcare worker themselves. It's about actually if there's a healthcare worker who may be very early on in their infection and may have no symptoms or very mild symptoms, but still able to transmit the virus. That's the purpose of having people wearing masks and they're protecting their co-workers as well as patients. We have to understand that everything we do, we have a finite supply of masks, other personal protective equipment. We are working in this pandemic when there's a global supply challenge. So everything we put in place, we need to put in place respecting. We need personal protective equipment for the short term and for the longer term. And so the plans to put in what we have for healthcare workers in hospitals wearing a mask, a surgical mask, is built within knowing we have capacity to do that, where we are looking at how we may expand beyond the hospitals, but it all has to be based on what we have in our supplies, what we anticipate getting, whether it's through federal procurement processes or whether some of the very creative work that is happening here with our local businesses about retooling their industries to start to produce some of these materials.
Next, we'll go to CTV's Natasha Pace.
Thank you. This would be for Dr. Strand. I'm just wondering if you could talk a bit more about the death that happened at the Cape Breton Regional Hospital. This is obviously the second woman who passed away this week at the same hospital. Is there any known connection between the two cases? I know we had more than 24 workers self-isolating from being exposed to the first patient. So I'm wondering if there's any known connection there at this point.
No known connections. These individuals were in different parts of the community. They were both admitted to hospital on the same day, but there was no other than that coincidence. There's no connection between the two.
Do you have a follow-up, Natasha?
Thank you. Premier McNeil, I'm wondering if you can address supplies. I know Dr. Strand just started to talk a bit about it, but last time we asked, I believe we had about a month of medical supplies available. Has that number changed at all? Have we gotten any more in? Is that still sort of what we're looking at this point in time?
So the number has not changed. We have about a month's supply. We are expecting orders quickly. Obviously, we're not going to count them until we receive them. You've also would have heard that Stanfield's is making garments. There's another company looking at how can they create the masks inside of our province, the surgical masks, as well as we're seeing some innovative work happening with companies around the clear shields that you would see being used inside of the province. So at this point, we believe and know we have enough to the end of April. If all of our current orders came in without any kind of increased production in Nova Scotia, we would be into the end of May, first part of June. But as Dr. Strang has just said, we're looking at, can we broaden out the ability to use the surgical masks more broadly within inside of frontline healthcare workers, because quite frankly, it is, as he just described, it is actually to ensure that if somebody is not realizing they're carrying COVID or very mild symptoms and are actually go to work, that surgical mask will prevent them from passing that on to a resident or a patient.
Next, we'll go to Olivier with Radio Canada.
Yes, my question is for Premier McNeil. Premier, I'd like to know what impact you think the programs you announced are having on the businesses that need help in the province, and do you think it's enough to keep those businesses healthy enough to survive the time they will need to be closed?
Well, there's two programs. One is for the business to help those that have had complete loss of their revenue, been forced to close down by the health order. It'll be 15% of revenue from February of last year, and if it's a new business, it'll be from February or March of this year. We'll analyze that, do an assessment of it. It'll be up to $5,000. It's not targeted towards anything. The company can use it to fill in and put any costs that they may be incurring. The deferred rental piece was an important part. We needed our commercial landlords to work with us and, quite frankly, the national banks to support them to provide another tool to keep these businesses viable. And the other one is emergency funding for workers, those who were either self-employed or didn't qualify for EI, or if they were qualifying, the process to get them qualified takes much longer than someone who had the proper hours. So we wanted to make sure that we provided them support. So it's $1,000, a one-time commitment up front as they work their way through qualifying for the federal funding.
Olivier, do you have a follow-up?
Yeah, sure. I want to add, we hear about an issue that retail stores that have closed in an effort to prevent further spread, but don't qualify for the provincial help. Do you think they deserve some help?
Well, some of this, they would qualify for some of the national programs that are available. One of the things that we said early on, we were working, how can we best mirror or put our programs together with the national program so that we can capture more people and support more people. And if you look at some of the wage subsidies that the federal government has since enhanced, 75% of the wages that companies could go in and apply for and receive back. And we're hearing news that people are rehiring based on that. What we've tried to focus on are those businesses that specifically were shut down by the order, one that Dr. Strang would have, and we wanted to be able to support them. That's why we looked at both the two things I spoke about, which was the deferred rental program, as well as ensuring that we supported them in the short terms with some medium-sized financing that would allow them to come out of this. None of us know how long this will last. We as a province may have to look at and revisit, do we repopulate this fund, but we'll monitor that as we go through. But what we're really trying to do, no province has the capacity to be able to hit every one of the challenges that we're faced with. What we're looking at is how do we make sure that the national programs, which are rolling out now, hit Nova Scotians, making sure that they know what's available, the businesses know what's available, the individual Nova Scotians know what's available, and then how can we build towards that so we capture more people so that no one's being left behind.
Next, we'll go to All Nova Scotia's Lindsay Armstrong.
Dr. Strang, New Brunswick, Quebec, Ontario, Newfoundland, Saskatchewan, Alberta, and now the federal government have all released projections of COVID-19, including potential deaths. You just told my colleague that it's about making sure the modeling is accurate before sharing. Can you help me understand what's the difference between the projection modeling in Nova Scotia and the models that have been released in these other provinces?
So each province has to put in the various factors that are within their province in terms of starting with our population, our demographics, projections of disease, and as well as accounting for some of our things like our testing strategy when you look at the number of cases you have. So some of the parameters in the model are the same, but many of how you actually populate them with your provincial specific data then changes. As I've said several times before, this is quite technical, sophisticated work that is a high degree of expertise. Smaller provinces have limited capacity to do this work, and so we are working at it within the ability that we have, and we're, believe me, we have been pushing the people doing this work quite hard this week, but they're doing the best they can within the given capacity, and we will bring forward that model when we're able to. Having said that, we know what's in front of us. We know what to do. We're focusing on that as well, focusing on the public health measures, focusing on rapidly expanding our testing program and then the public health follow-up. That, quite frankly, has been the primary focus of a lot of work. Not that the modeling is not important, but we can't let the modeling distract us from the very real on-the-ground work of addressing this disease every day in Nova Scotia.
Lindsay, do you have a follow-up?
Yes, for the Premier, we know that Nova Scotia lost 25,000 jobs in the first weeks of COVID-19, but that data was collected before the state of emergency. Will these numbers look worse in the weeks ahead?
Oh, I believe when Stats Canada do it again, of course. I think that unemployment rate of 9% is actually low. I don't think it's captured the true impact that's happening in our province right now. I will say, though, to those that are out there continuing to work, continuing to provide, working with health protocols, the 6 feet separation on many of our job sites, we need them to continue to drive economic opportunity. And we as a government are looking at what are some of the infrastructure projects that we can pull forward in the coming months, making sure that our tenders are out so that when we see the other side of what's happening here with COVID-19, that we will be able to rebound out of that. Unlike most Canadian provinces, we came into this with a growing economy, fiscally stable, recognized by banks, by the national government, the financial situation of our province. Many companies in Nova Scotia were doing well. They saw growth. They saw an opportunity to hire more people. This has certainly put a huge roadblock in front of us, but I can tell you in 2013, when we started the journey of bringing ourselves at a $500 million deficit, young people leaving our province, it was a big hurdle as well, and we were up to the task. And I have every bit of confidence that once we see our way through this pandemic, Nova Scotia's entrepreneurs will do what they've always done, start to rebuild, and their government will be there with them.
Next, we'll go to the Chronicle Herald's John McPhee.
Yeah, this is a question for either the Premier or Dr. Strang. The crowded lineup outside the Bears Lake Costco are continuing this week. A worker told one of my colleagues last night that they're afraid for their health. There's such crowding going on. Has the province been in contact with Costco to address this problem?
So what we've been doing is through the labor and advanced education, as I said a few days ago, the occupation health and safety inspectors have put a focus in the last few days of visiting all our big box stores and the grocery chains, and we continue to work with them. They can do that, and I think a lot of them are doing what's necessary within their in-store environment. Some of this ultimately comes down to what people are doing outside their stores, and it baffles me why we continue to have these behaviors. Police are aware of this. Police are out there enforcing the public health order in a number of ways. But ultimately, it comes down to Nova Scotians that why do we continue to put ourselves and each other at risk when we know that if we're just use some common sense, we'll all get the things that we need to have, the essential shopping we have to have. But I'm somewhat baffled to hear that this is still going on.
This is one of the biggest frustrations that I would say Dr. Strang and I both have. You guys continually ask us, how long is this pandemic going to go on? We hear from business owners, when can I open? What I'm going to tell you, as long as Nova Scotians continue to act irresponsible when it goes and stands in the line in front of Costco, this pandemic's going to continue to go on. What happens if there's a healthcare worker there? What happens if you're passing it on to a family that goes home and hands it off to their grandparents? What happens if they take that in and the young children contract the virus? All we're asking people is stand 6 feet apart. That will determine how quickly. We can do all the modeling we want. Every province is doing modeling. What will determine it will be how its citizens respond to public health orders. Self-isolate, wash your hands, separate 6 feet. That doesn't mean just at home in our yards. More importantly, it means when we're out standing around strangers. This absolutely makes no sense. I'm going to tell you, we just announced to a second Nova Scotia family today who lost a loved one due to this virus. How many more Nova Scotians are going to have to die before people understand this is a deadly virus? This is frustration. Let me tell you, no matter how hard we work, no matter how hard most Nova Scotians do this, if people continue to show this behavior, we are going to continue to see deadly results from this virus.
John, do you have a follow-up?
Yes, I do. Given the risk of exposures that cashiers and clerks face, and the fact that Dr. Strang just said we could be looking at 2021 before this ends, should we do more to protect them, such as toughening up rules around groups of people going to the store and to the post office? I mean, the Premier is getting frustrated with people not obeying the rules, so should we be bringing in things like making stores higher security to go around and make sure and put, lines to demarcate 6 foot distances, that kind of thing? Should we be doing more instead of relying on the public to obey the rules?
Well, let's be clear. Many retailers are. Sobeys, the Nova Scotia grown company, is with shields around its cashiers. We're seeing Atlantic Superstore where there's people at the door and preventing people from going in. You look at the Nova Scotia Liquor Corporation, if you go in, there's a mark that you're standing 6 feet away. There's many protocols in place. There are though those few who continue to avoid doing what is right to protect their customer. And as the good doctor said, enforcement will be out this weekend. Labour and Advanced Education will be working with those, and it is incumbent on Costco. It is incumbent on Costco, as well as it is every Nova Scotian, to ensure that the people going into those facilities are safe. And we expect them to follow the public health rules of this province and do it in a manner which has been laid out in front of them. Otherwise, it's going to be in a position where we're going to be left to make some very hard decisions that will potentially impact individual businesses.
Next, we'll go to Michael McDonald with the Canadian Press.
Oh, my question is for Dr. Strang. Doctor, the Public Health Agency of Canada tells us that 62% of the COVID-19 related deaths in Canada so far can be attributed to people who are over the age of 80. With the peak in cases coming in Nova Scotia in the weeks and perhaps months ahead, what is the province doing to take into account that Nova Scotia has one of the oldest populations in Canada?
So, as we've been talking about all week, and as a key part of our whole response is a very strong directives to our continuing care sector, home care agencies, and long-term care facilities. We're doing what we can to ensure that our most vulnerable in our long-term care facilities are protected. We very early on we closed them off for visitors. We stopped residents traveling out into the community. We earlier this week we announced clearer, detailed directives on how long-term care facilities are now required to take steps in terms of screening staff, monitoring residents, following outbreak control protocols that are being put in place by public health. We understand that there are many seniors living out in communities, and that is why we continue to push that we can do so much. Certainly when people are under care and in facilities, there's a lot we can do to protect them. When they're out in communities, this is much more in the hands of communities. So I would kind of push back on your question and say, what are Nova Scotians doing? And many Nova Scotians are doing fabulous things to protect seniors and other people because of health conditions that are vulnerable, keeping them isolated, bringing them groceries, giving them support. But some Nova Scotians aren't. They seem callous to the fact that their behaviors is what will allow this virus to spread, and it is those most vulnerable who will have the most severe impact. So, yes, governments can do things, the healthcare sector can do things, but ultimately all Nova Scotians need to think about the senior or the person with a health condition that's in their community. If you're not thinking about yourself, as I said earlier today, think about who else you care about. Think about your community.
Michael, do you have a follow-up?
Yes, I do. Just one quick one for Dr. Strang. Doctor, yesterday, health officials in Newfoundland and Labrador, as you know, released their projections, and one of them suggested that the peak for cases in that province would be mid-November. Do you think that will be the case for Nova Scotia?
I haven't seen the Newfoundland modeling at all. I haven't seen any type of modeling that would produce the peak of the first wave. It may be, there's certainly, as I said earlier, there are certainly concerns that we might get a second wave into the fall. That may be what Newfoundland is showing, but certainly we're in Nova Scotia. What we're anticipating, we're in the next, we're in the next few weeks into the end of April is when we're likely to see our peak. But I'll use your question as an opportunity to keep coming back to how big that peak is, how big the impact is all in our hands. What we're asking people to do today and in the coming weekend, over the next couple of weeks, is critically important to how much we can bring down that peak, how much we can spread it out, and minimize the impact on our communities, and allow our health system the chance that we have enough capacity in our health system to deal with those who are going to need need care for COVID or other things as we go through this wave.
Next question will go to Sharon Montgomery with the Cape Breton Post.
Oh, hi. Thank you. Good afternoon. I'd like to ask Dr. Strang a question, please. Where Eastern Division includes Antigonish and Guysborough counties, people of Cape Breton feel they aren't getting a true picture of how prominent the virus may or may not be here on the island. And we're wondering if you could give us an idea of the extent of the impact here.
So we know we have disease in communities across the province. I will point the fact that, unfortunately, the both deaths we've had have been in the Cape Breton, industrial Cape Breton area. If that's not a wake-up call for Cape Bretoners to understand that they're in the thick of this, like the rest of Nova Scotia, then I don't know what more they need. Frankly, we are looking at ways that as we can start to provide perhaps more information, at a greater level of detail below the health zones. Again, as I've said in previous questions about this, we have to be careful about that because we in areas where there may be only 1 or 2 cases, we have to make sure we're continuing to respect privacy laws. We have to be very careful. As I spoke earlier today, we're already seeing, unfortunately, some people making judgments about others in our community because of what they've heard about how disease is playing across Nova Scotia. So there are challenges, and we have to be thoughtful about what level of detail we provide to Nova Scotians. But we are looking at ways we can provide a somewhat greater level of detail. But I come to my point that I make as much as I can. This is an issue from Yarmouth to Amherst all the way up to industrial Cape Breton and everything in between. And no part of Nova Scotia, no Nova Scotian should feel that they're not at risk and that they don't need to do the preventive steps that we're asking them to do.
Sharon, do you have a follow-up?
I do. Thank you. I'd like to ask Dr. Strang as well. We're wondering when the mobile units will be set up in the CBRM in Elmsdale, and if the expanded community testing could include random testing of people who work with essential services, such as grocery stores, who are not showing symptoms.
So the first step is around your mobile test. There already is. We have several different ways of where we've expanded testing. As I said a couple of days ago, one of them is we have 2 AHS crews, SUV with paramedics who are trained to take tests. One is in CBRM, one's in HRM, and that where necessary, where there's somebody because of mobility issues or maybe at a single long-term care facility or some other small groups of people, that we can deploy that mobile EHS crew to do some testing. And so, as I said, one of those is operational today up in industrial Cape Breton. We also have the mobile unit that is getting close to ready to go. I haven't had an update on that in a few days, so it may actually be ready by now. That if necessary, we could deploy that. But as we've done in 2 areas of our province, we've used existing infrastructure in healthcare facilities or community centers to actually establish temporary assessment centers and bring in testing when we have concerns that we need enhanced testing in a small geographic area. And so we have that ability. And if there are other parts of the province, including Cape Breton, that we had those similar concerns, we can rapidly bring in establish those temporary assessment centers as well. As to your point about whether we want to target specific groups, we are in our assessment centers. We have made sure that because healthcare workers remain at increased risk for being infected, they're also critical that we understand the status of our healthcare workers and they're not transmitting it to their patients. So we are making the testing of healthcare workers a priority. I think as we've loosened up the criteria, so as I've said, there 5 clinical symptoms that people have. If they have 2 or more of those, we'll get them in and get them tested very quickly. I think that greatly loosening up our criteria for testing includes everybody, including including grocery store workers and others. And I think that's the approach that I think is the best approach, is no matter where people work, what they may be doing, if they have symptoms that may demonstrate COVID, we get them in really quickly and test them. And what we also do, if somebody is positive, then we very quickly identify their close contacts and test all of those right away as well. And as I've said this week in previous briefings, we are actually seeing that working. We have a number of our new cases are actually contacts who have been tested, and because we're testing them early, that we've isolated them as soon as we become aware of them. When we get the results back and they're positive, they have not exposed other people.
That's all the time that we have today for questions. Go ahead, Premier.
Thank you, Chrissy. As Dr. Strang said in his opening, Easter and Passover traditional times for celebration, love, and family get-togethers, but not this year. The Easter Bunny will come this weekend because we all know the Easter Bunny is an essential service. But the Easter Bunny should be your only visitor this weekend. If you're thinking about having people over for Easter dinner, do not, please. If you are tempted to have the first barbecue of the year and invite your neighbors over, do not, please. If you're considering stopping by to show the grandparents what the kids have got for Easter, do not, please. There will be other Easters, there will be other celebrations, there will be other long weekends. This is an opportunity where we need to be by ourselves and we can call and visit our family and friends. But everyone needs to follow the appropriate health protocol. We reduce our chances by having those gatherings sooner if we all do that. So if you're at home this weekend and you think about washing your hands, please do it. If you are going to the grocery store or the pharmacy and you think you should be social distancing, please do it. If you're thinking I should stay home, yes, you should. Please do it. And finally, if you think you should reach out by phone, by Skype, by FaceTime, or to meet a loved one, please do it. Dr. Strang and I are going to take our own advice and stay inside this weekend. We will not be here for our daily briefings this weekend, but we will be back on Monday. We will be staying on top of what is happening in the province, and we will keep you updated through daily updates. I've asked you to reach out to someone this weekend to let them know you care, and now I'm taking my own advice. I'm reaching out to all of you to let you know that the good doctor and I care, and that we are all in this together. And if we follow his advice and the advice of public health, we will be out of this sooner rather than later.